Wake up.
You ready? Okay, let's call the December 12th Medical Services Board to order. And Judy, if we could start with your roll call, please.
Christy Blakely. Present. Timothy Fox.
Here.
Patricia Gibbons.
Present. On the phone.
Regina Hughes.
Present.
Brenda Lacombe. I believe she's going to join by phone. Dr. Malinkovich.
Here.
Amanda Moore.
Present.
Jenny Riley.
Here.
Donna Roberts is excused. Mike Stahl.
Here.
Mary Young. I believe she'll be joining us also. We have a form.
We have a quorum? Great, thank you. General announcements, date and location of the next Medical Services Board meeting. The next meeting is scheduled to be held Friday, January 9th, 2015, beginning at 9 a.m. at the 303 East 17th Avenue, Denver, Colorado, in the 7th floor conference room. It is the policy of this board and the department to remind everyone in attendance that this facility is private property. The capacity of the meeting room is 80. Please do not block the doors or stand around the edges of the room. Please turn cell phones off while in the meeting room as they interfere with the recording equipment. And if this room happens to fill up, which I'm doubting it will today, but if staff could please give up their seats for guests that are here. And if you're listening via the audio stream and lose a connection, please just click again on the link to rejoin the meeting. As we're speaking, please speak directly in the mics and identify yourselves when speaking. There are individual testimony sheets back there for each of the rules, as well as open forum. So if you would like to speak in front of the board, please sign up on the forms back there on the table. And open forum has a 5-minute limit for all testimony. So with that, I'd look for approval of the minutes from the November 14th, 2014 meeting.
Good morning, Mike. This is Brenda. I just wanted to tell you I just got on.
Thank you, Brenda. We're looking for a motion for approval of the board minutes from November 14th.
I'm trying to do that, yes. But I'm not sure which one to read. That's an initial and that's an initial.
You just moved. I mean.
Oh, moved, so moved. Second.
Got a motion and a second. All those in favor of approval, please signify by saying aye. Aye. Any opposed? Okay, who's all on the phone again?
Stayed only because I wasn't at the last meeting.
Okay, great. Let's do a quick roll call on the phone again. We've got Brenda on the phone, correct?
Correct.
And we've got Patricia Gibbons.
Correct.
And has anyone else joined us on the phone?
Jenny Riley.
And we have Jenny and we have Mary. Are you all in favor of the minutes?
Aye. Aye.
Very good. Okay, let's move into the emergency agenda. If I could have a motion for the emergency adoption agenda?
I'll do it right this time. Move that all emergency rules that are adopted include the finding that their immediate adoption is imperatively necessary to comply with state or federal law or federal regulation or for the preservation of public health, safety, or welfare, and that compliance with CRS 24-4-103 would be contrary to the public interest.
Have a second?
Second.
All those in favor of the emergency adoption agenda signify by saying aye. Aye. Brenda?
Aye.
Dr. Gibbons?
Aye.
Jenny?
Aye.
Mary?
Aye.
Thank you.
I didn't hear my name. Sorry.
That's okay. Okay, if I could have a motion then for document 1, please.
I move the emergency adoption of document 1, MSB 14-10-28-A, revision to the medical assistance eligibility rule concerning allowable deductions, section 8.100.4.C.1.D, incorporating the statement of basis and purpose and specific statutory authority contained in the records.
Thank you. Could I have a second?
Second.
Thank you. We got a motion and a second on document 1, and we have Anna Bordalo.
That is correct.
Welcome.
Good morning, Mr. President and board members. Thank you for your time. My name is Ana Rafael. I am the Child Health and Policy Specialist. And with me today, I have Jeffrey Oliver, who is our General Policy Specialist. We are here today to present the rule on allowable deductions to calculate the modified adjusted gross income for our Magi Medical Assistance Programs. Currently, the rule is not in compliance with federal regulations. The allowable deductions identified are not all applicable to determine the modified adjusted gross income. The proposed change will define what deductions are allowable as defined under the Internal Revenue Code Title 26 U.S.C. Section 62 to get the modified adjusted gross income required to determine eligibility for our Magi Medical Assistance Programs. Currently, there's no update needed to our Colorado Benefits Management System. It is in alignment with our federal regulations. The department has also created an FAQ to help address any questions regarding this policy change. So, and we do appreciate any feedback, the feedback that was given to us from the Attorney General Office. With that said, are there any questions?
Questions from the board on this rule? Okay. We do have one individual signed up for public testimony, Bethany Prey, I believe.
Yes.
If you'd like to come forward and introduce yourself and who you represent and your support of this rule.
Good morning. My name is Bethany Prey. I'm at the Colorado Center on Law and Policy, and I have several concerns about the regulation as it's written. In terms of the specific changes that are requested, I would point out that on page 2, line 14, the deductions are described as allowable. 26 U.S.C. 62, when it describes adjusted gross income, does talk about allowable deductions. However, AGI, for the purposes of Magi eligibility, would essentially require those deductions. In order to get an accurate AGI, an accurate Magi deduction, you would need to do those deductions. I think it's somewhat confusing or unclear to emphasize the allowability rather than the necessity of making those deductions. And I would omit the word allowable where it's written twice. I would also say in terms of the language that would refuse to incorporate changes to the tax code, also in that section, I think that the goal of Magi methodology under 42 CFR 435.603, which is the federal regulation adopting Magi methodology both for Medicaid and for premium tax credit purposes under the exchange, would be to continue to remain in compliance with the tax code. I'm not sure what the reasoning is for separating those and saying that that changes would not be incorporated. And then there's a list of deductions from line 38 on page 2, and it's incomplete. I don't know, it's sort of hit or miss in terms of adopting what language is in 26 U.S.C. 62. For example, it says that it excludes business expenses of certain employees and names certain business expenses of reservists, performing artists, and fee-basis government officials. Also on that list in 26 U.S.C. 62A2 are the certain business expenses of employees generally and elementary and secondary school teachers. As an example, I'm just not sure what the choices made are there. And I just want to point out one sort of larger concern, and I appreciate the opportunity to bring this forward, is that the regulation, the entire regulation, captures pieces of Magi methodology, but I don't think that the proposed changes are enough to bring it into compliance. I think, the pillar of MAGI methodology is 42 CFR 435.603. That is where the government, the federal government has established how we're using MAGI methodology. The Colorado regulation instead goes straight to the tax code, which is referred to in the federal regulation, but is not the first step. And that's important because the CFR regulation also has some really important language, for example, about inclusion of children's income in MAGI methodology. And it's our understanding that Colorado may have been incorrectly considering a lot of children's income when computing household income. So, I mean, I'm concerned just generally that the regulation is not capturing the things it needs to capture. So, thank you for the opportunity to speak.
Thank you. If I'm just summarizing kind of your point, you're in support of the rule, but you want it to follow the federal regulations that are out there and make sure that they mirror.
Correct, but I think as it's written, it does not.
Right.
But I also, one of the obstacles here, of course, this is a rubric, and the MAGI rubric, which encompasses a huge amount of tax code. I'm not a tax lawyer. I'm a lawyer, but I'm, trying to figure this out myself. And one cannot capture it in a regulation. It would have to be really by reference. And some states have merely referred to the CFR regulation and left it at that because it's like a door to a huge world of tax code. But to have a regulation that sort of picks out pieces of it but doesn't do it comprehensively is really going to miss some important things like this issue of children's income.
Okay, thank you. And since it's coming as an emergency rule to become in compliance with federal law, I think that's an important piece. Dr. Milinkovich?
Well, that was my question. Since this is an emergency rule, would it be possible to pass the rule as necessary to comply with, in the way we think, or in the way the department thinks it's necessary to comply with federal regulation, and then go back and change the rule to be more accurate and to better reflect the concerns that you've expressed? Is that a possibility?
Yes, yeah, because it has to come back anyway for permanent adoption, so it could be right.
I mean, do you have specific recommendations? Could you work with the department around specific recommendations?
Absolutely.
Or are there examples from other states as to how they've done it that this state could do it?
Well, I can pull together some more examples. I mean, Kentucky's, for example, is very short because it really just refers to the regulation and says, go from there. But there are a lot of other examples out there, and I can try to pull those together and work with the department.
Ms. Blakely?
To follow up on Doctor's recommendation, what is the harm in not passing it as it is and giving a month to correct it? What's that harm? So, rather than passing something that's incorrect.
Ms. Blakely, for the question, the harm would be that we would be using appeals for that because a client can be determined, they can get denied for medical assistance, but because our policy states that they're allowed to use those deductibles, those deductions, we would have to grant them eligibility. So we would be losing appeals for that.
There are certain deductions that are currently in the rule which are not part of 26 U.S.C. 62. MAGI, modified adjusted gross income, is defined by determining what adjusted gross income is and then adding some income back in. There are some deductions that are currently listed under the rule which don't follow that path. They go to adjusted gross income and then are used to determine what is your taxable income. And those are individually defined in the rule. And so those are can, under appeal, be allowed as allowed to give somebody benefits when they should not be allowed via federal regulation.
I don't know if I can comment again.
Yes, please.
So I understand. So what's being said is that it's over-inclusive as it's written, and it's allowing people eligibility who are not entitled to it. And I would argue that there are plenty of other things in the rule that deny eligibility when people are entitled to to Medicaid. So to me, it's less than a wash. I think they're probably more losing eligibility than are incorrectly gaining it. And I don't have any numbers on that, and perhaps I could get more information about the population that's incorrectly getting Medicaid. But I do pretty strongly believe, and I have a few examples, but not a large number, where people are denied because of some of the language in the bill, in the regulation.
Can I ask, with the department, is there general agreement with Ms. Prey on that how it's written here does not completely comply with federal law?
Well, it does, as far as 603 goes, I would agree with Ms. Prey in that factor, but that's beyond the scope of just this portion of the law. And one of the subjects she's brought up, we are looking at, and we will be reaching out with CCLP on that very subject regarding children. But that also falls out of the scope of what this law is trying to do. What this law is trying to do is properly account for the appropriate deductions. Now, Ms. Prey did bring up some deductions that are not listed in here, including the educator expense. The educator expense was sunsetted in 2013. It's no longer an appropriate deduction by a congressional action, which is why we didn't include that in. There were a couple of items that sunsetted in 2013, which is why it's not a complete list, which is also why we did directly refer to 26 U.S.C. 62, so that anything that was not captured in the itemized aspect could be captured through that reference.
Is it a complete list for what is current deductions?
It is a complete list for what should be current deductions, what is either currently in the system or will be in the system.
Okay. Ms. Blakely?
Mike, would you ask that question again? Because my question was, what's missing that should be there? Because if there's anything missing that should be there, then we need to rethink this.
Well, my question is, as we're talking about deductions, and there's question if it's a complete list or not, and understanding that things are sunsetting all the time, and we can be looking at different lists. Best to your knowledge, what is currently listed as deductions in the federal law is listed here?
To the best of my knowledge, there is a deduction for vehicles that don't use certain forms of, like electronic vehicles that may not be listed in here.
I believe it's clean fuel
Clean
vehicles.
fuel vehicles, that's not listed here.
Could it be? Should it be? I mean, if we want a complete list of deductions. Okay. The other point Ms. Prey brings up is just the title of allowable deductions. To just strike in the word allowable and calling them deductions. Is that appropriate, or?
The allowable deductions on the title, that just goes with the format that we've used. So if you notice, we have gross income as the title under 4.CA. So that's just the title that we're using. It's a format that we're using.
With consistency of other rules, is that?
With consistency, yes, of this policy under MAGI.
Okay.
This policy, excuse me. But it's, as she's saying, this policy not, so it would be changeable.
Yeah, absolutely. Could be. Dr. Milankovich?
So let me just, it sounds to me like there's some wording and some references that could be changed. But if we pass this rule, I'm asking the department, are we going to be denying more people than we should be? Or are we going to be allowing more people that should be allowed eligibility?
If we pass this rule, we should be giving the appropriate number of people eligibility based upon the appropriate deductions.
And not inappropriately excluding people.
We should not be inappropriately excluding people. If we are not allowing the appropriate deductions that's already either directly cited in this rule or referenced through 26 U.S.C. 62, they would have the appropriate appeals right to be able to get approved.
Okay. Ms. Prey, any other comments for us?
Well, I guess I would, I appreciate the correction on the sunsetted provision. And that if there's going to be a list, that it either be a complete list or it not be a complete list, but not that it be, someplace in the middle. And that the reference to 26 U.S.C. 62A2 could be, as mentioned in the rule, could stand for the entire list, if it's not going to be put down item by item. But I still would really greatly appreciate the opportunity to come back and talk about other parts of the regulation, because I think there are lots of other pieces of the earlier part of the regulation that could be brought closer to compliance.
The one issue is there is one deduction that is allowable but not captured in 2662, which is domestic production activities deduction. That is actually captured in section 199 of the IRS tax code, which is why that one is listed out. But I just wanted to point out that one aspect.
Okay. Ms. Blakely?
I'm concerned that Ms. Prey has brought up enough concerns. I mean, like, even the clean fuel, that's going to miss families. But I didn't hear enough about the children income to understand whether that's missing from this rule or needs to be added. But I don't know that a month in correcting what we've got wouldn't be a better option for us, so that next month we get it whole.
The issue with children's income is not an issue on deductions. Just to be clear. It's an issue of whether a child needs to is required to file taxes. And if a child is not required to file taxes, then their income should not be included.
So I'm looking at this rule, and you guys are the ones that have looked at it a lot in the legal side, and I'm not sure the referencing or referring by reference, if this falls under that new category that we can't refer things by reference, that we're changing a lot of our rules back that we were referring.
No, this is, it's incorporating the
Incorporating by
federal
reference,
code,
okay,
so it's
okay.
incorporated.
So if we're looking at we're out of compliance, and this gets us 90% to compliance, through the next month, there's no reason if we find out that 10% that we're out of compliance, that we don't bring it back as an emergency rule again next month to finish that, correct? I mean, if we're out of compliance with the federal rule, it can come back as an emergency rule. There's some disagreement of if we're out of compliance or not. But this brings us a lot closer to compliance. It sounds like
Absolutely.
that.
That makes sense.
Right? Other questions from the board? So, thank you, Ms. Bray, for your testimony. Appreciate that.
Mr. President,
Yes.
this is Mary Young, and I have some concerns about, even though it's an emergency adoption and it brings us closer to the federal rule, I have some concerns about passing this based on the impact to me is unclear. And also, I'm not understanding why it needs to be done, maybe this has been answered and I apologize, but why it's to be done today rather than next month?
Would the department like to answer that?
Yes, the impact would be that we would be losing appeals because the client would be denied for medical assistance and of course would appeal and we would have to grant the client eligibility. So that would be the impact. for this rule change.
Question.
Yes, Ms.
This is
Hughes.
Brigida. So if they were denied and they appeal it, do they renew, is it a renewal of application annually? Would they stay on the program for a year or 3 months, or how does that work? Once on, you stay on forever, or what?
It's not a guaranteed program for these clients.
Uh-huh.
So they would, and that's something that we're working with. So they would stay on until we would propose a rule change, but we would definitely notify the clients if they were going to be denied in the future with 10-day noticing. So we would give them appropriate noticing if we were going to change their eligibility, since they were.
Mr. President,
Yes?
this is Pat Gibbons. I didn't mean to interrupt, but my understanding, if I'm hearing correctly, is we could err on the other side as well. It sounds like we could have error on either side, either granting eligibility when it doesn't fit with what we think is going to be on this list, or not granting. Is that a fair understanding? It's not just a one-way consideration, if I'm hearing the discussion correctly.
Correct, you're correct with that. Yes. Dr. Malinkovich?
So I want to get back, I think, to a question I asked earlier, maybe I didn't ask it clearly enough. It sounds to me like what we're saying is if we don't pass this as an emergency rule, we would be potentially denying people eligibility. They would appeal, and they would win their appeal because the rule is written incorrectly.
That's correct.
So we would be inappropriately, ultimately, allowing eligibility when we should not be allowing eligibility. And so when I asked earlier, if we pass this rule, it sounds to me like the impact will be to limit eligibility for those who shouldn't be eligible. But it has no impact on, as written, it has no impact on allowing eligibility for those who should be eligible. Even though there were some concerns raised about how the entire rules are written around MAGI, this rule would not impact, would not change that.
That is correct.
Okay.
Ms. Blakely?
Appeals are typically scheduled for at least a month out. So my question is, how many appeals are scheduled in this next month? Because with this next month, there's also less appeals scheduled during this time of year, happy holidays.
I thank you for the question, Stacey. I am not certain on the number of appeals we're receiving, but it is.
There have been at least 2 appeals received on this subject. One of which was, I believe, already came to a conclusion. I don't know if there are further appeals that are received on this subject, because I don't usually do the appeals process. But we can reach out and see if there are other appeals on this issue down the pike.
Ms. Blakely?
So considering those numbers, waiting a month and making sure we've got everything we need, working with CCLP or Ms. Bray, whatever, we really only have one person that we're aware of, one kiddo that we're aware of would get services. And we would be able to deny that the next month if that was found to be.
I will have to check with appeals to see if that is really the scope of the issue at this time.
Is there comments or questions from folks on the phone? No? Okay. Other questions here? Ms. Moore?
Mr. President, it seems as if it would be in our best interest to pass the emergency adoption to then work later with whatever services that we need to make sure that we're really accurate. But from hearing kind of what we've all spoken about, it seems as if it would be, we would err on a better side of adopting today and then making making changes to it later. And because I hear what you're saying, Ms. Blakely, but it seems as if the end number of the appeals is still low. We don't know by not making this adoption what that would go up to. And that almost seems as if almost wasted work on the department's efforts to even go through these appeals. If we could limit that and then clarify it the next month, if that's a possibility of doing that time frame.
Okay. Any other comments from anybody here? Nobody else has signed up for public testimony. Would anyone like to sign up for public testimony? All right. Seeing none. So the motion on the table is for emergency adoption of document 1. We've got a motion and a second. All those in favor of approval of document 1, signify by saying aye.
Aye.
Brenda?
Aye.
Dr. Gibbons?
Aye.
Ginny?
Aye.
Dr. Young?
Aye.
Any of those opposed?
Yes.
Okay, one opposition. Okay, so we've got document 1 passed by emergency adoption. We look forward, I think, as a board to hear this again next month with kind of pulling this even closer to adoption. I would really recommend that we pull this back as quickly as we can. So, thank you very much.
Thank you.
Moving on to initial approval agenda. If I could have a motion for document 2.
Move the initial approval of document 02 MSB 14-10-31-A, revision to the medical assistance eligibility rule concerning a rule citation correction, section 8.100.7.B.1.C and 8.100.7.B.2.C, incorporating the statement of basis and the purpose of statutory authority contained in the records.
Could I have a second?
Second.
Thank you. And for the department, we have Eric Stricka here. Welcome.
Morning, Mr. President, board members. My rule is really, it's real simple. It's just a cite by reference correction that's in rule. And we did the MAGI rewrite Affordable Care Act. It was kind of a big undertaking, and we moved one of the rules forward. So the rule that I'm changing it's the 8.100.7.B, which kind of sets the financial eligibility categories for individuals that if they get the level of care, they can receive long-term care services or home and community-based services. This rule it points back to the working adults with disabilities, and it was, we moved it from O to P, but it remained at O, so it's pointing to a Medicare savings program instead of the working adults with disabilities, even though it mentions the actual category in the rule. So we're just tightening that up and making sure it's correct.
Questions from the board on this change? Anybody have a question that's on the phone? Do we have anyone signed up for public testimony? Would anyone like to sign up for public testimony on document 2? Okay, seeing none, we do have a motion and a second for initial approval of document 2. All those in favor, signify by saying aye.
Aye.
Aye. Dr. Gibbons?
Aye.
Ms. Lacombe?
Aye.
Ms. Riley?
Aye.
Dr. Young?
Aye.
All right, we have approval of document 2. Thank you very much.
Thank you.
All right, moving on to document 3. Motion, please.
I move the initial approval of document 3, MSB 14-07-28-A, revision to the medical assistance health programs, benefits, and operations physician services rule concerning podiatry services, section 8.200.3.A.8, parentheses 8.200.3.D, parentheses, incorporating the statement of basis and purpose and specific statutory authority contained in the records.
Second.
Got a motion and a second for document 3. Thank you. And we have Richard Delaney here. Welcome.
Good morning, Mr. President and board members. My name is Richard Delaney. I'm a policy specialist in the Health Program Office. And joining me is Frank Furr, who's the policy and compliance analyst in the operations section of our team. We're bringing forward this rule. It's one of those benefit coverage standards that we previously approved and incorporated by reference. We're now, our policy now is to insert the actionable items from the coverage standard into the rule. So we've taken a 6-page standard and converted it into 2 pages of rules. Our intent is not to change anything, it's just to incorporate or to add 2 rules, information from the coverage standard. The coverage standard has been in effect for a year and a half, close to 2 years now, and it seems to be operating well. We're not having any problems. No one attended the public rule review meeting, and I did send the rule to the stakeholder that was most active in the creation of the benefit standard. They acknowledged the receipt of the rule, but I guess they felt fine with it because they didn't respond with any concerns.
Okay. Questions from the board on document 3? We do have one individual signed up for public testimony. Pat Look, I believe is the name. You could come forward and introduce yourself, who you represent, and your support of this rule. And please speak into the microphone. If you could move the microphone over. Thank you.
I haven't had this chair yet. I'm Pat Cook, C-O-O-K instead of Look. I am a retired nurse, did a lot of podiatry care in my work in community health, and I want to thank the President and the board for allowing me a couple of minutes. I would like to encourage one expansion. What's missing in this is low visual acuity for glaucoma, macular degeneration, and other visual issues. And in our work in the community and with our work with seniors, I'm with the Colorado Gerontological Society, we don't get to take care of this population of people under Medicaid, under HCBS, services in their homes. So it's not a covered benefit. It's often hard to get folks out. We have nurses in the community that will provide the service for free sometimes, but we're not allowed as nurses to do people with these neurological issues such as diabetes and MS and stuff. So I would like consideration that we expand this one little tiny bit and include this population of people.
Okay, specifically which population again?
Low visual acuity, macular degeneration, glaucoma, blindness, natural blindness, or blindness from being in an injury of some sort, closed head injury, that type of thing. But this is a population of people that does not get served podiatry care under Medicaid.
Okay.
And it's a high need, especially in the older adult population.
Thank you. Mr. Delaney, do you have comments on that?
Yes, Mr. President, members of the board. The people eligible for the podiatry services, it's the documented illness of a systemic disease, basically diabetes or something. That's information that is that we duplicated from CMS's podiatry coverage. The coverage standards up for review in May of this year. And at that time, we'd be happy to entertain expanding the type of diseases that relate to the need for podiatry services. We have to do some clinical research to look into the studies, published studies about whether macular degeneration and blindness does in fact lead to foot issues. But we're happy to do that. At this time, we're not prepared to add that criteria to it.
So this is in compliance or matching CMS currently. You're saying, though, that is going to be relooked at this spring?
Yes. Except for reviews.
Okay.
And these diseases or conditions were brought up 2 years ago when we created the benefit standard. But we're happy to look at it and make decisions that way. We're just not prepared to make that change today.
Okay. Questions from the board? Or any questions from Ms. Cook?
No, but I appreciate that we're going to get it on the agenda in the spring for an expansion for caring for those folks. It's not so much that macular and glaucoma and all that, lead to podiatry, is that they don't get foot care, and so therefore they have new issues because their feet are not being cared for appropriately. They get ingrown toenails, they get fungus infections, and all those lead to other disease issues. So if we can visit it this spring and be included in that, we'd appreciate it.
I would request that you make sure Mr. Delaney has all your contact information for him to be able to contact you as a stakeholder at that point in time. Thank you. Dr. Milekovich?
Thank you. I'm looking at the rule again, and I'm actually having trouble figuring out where it is defined who is eligible for services. Is that?
It's under 810.4.c, limitations, routine for covered services are when, and then it's basically C, as part of another device covered services document indicates presence of metabolic, neurological, peripheral vascular disease, or there is evidence of pathological nail infection.
Got it. Okay.
So if people with macular degeneration do end up with fungus in their feet, then they become eligible for that reason. But as we'd like to look and see if we can prevent it getting that far, if that would be appropriate.
Very good. Any questions from anybody on the phone? Okay, how about any other board members? Anyone else would like to sign up for public testimony that hasn't had a chance? Seeing none, we've got a motion and a second for document 3. All those in favor signify by saying aye.
Aye.
Aye. Ms. Lacombe?
Aye.
Ms. Riley?
Aye.
Dr. Gibbons?
Aye.
Dr. Young?
Aye.
All right, we have initial approval for document 3. Thank you very much. Moving on to our last rule, document 4, if I could have a motion.
Revision to the medical assistance community living benefit rule concerning in-home support services, section 8.552.
Incorporating.
Oh, I'm sorry. I'm going to give up here really. Incorporating this statement of basis and purpose, specific statutory authority contained in the records.
Thank you.
Got that tattooed somewhere on my body.
Some motion, do I have a second?
Second.
Got a motion and second for document 4, and we have Candy? I guessed right, I got 2 names down here. Welcome. If you'd introduce yourself, please.
Thank you. Good morning, Mr. President, members of the board. I'm Candy Dalton. I'm the Participant-Directed Program Specialist with Long-Term Services and Supports, and I'm here to present this rule for in-home support services. Before I tell you a little bit about the rule, I just want to give a little bit of background of in-home support services. It's one of 2 consumer-directed options that's offered by the department to individuals who are eligible for certain home and community-based services waivers. It allows clients who enroll in IHSS to select who they want to provide their services and have more control over the scheduling and the supervision of those services. Most of the components of this rule are brought through legislation that was passed this last session, House Bill 141357. There were 6 major components of that legislation. One was specifically stating that IHSS could be provided in the community. Prior to this change, there was different interpretations of whether or not IHSS could in fact be provided in the community or if it could only be provided in the home. It's home and community-based services, so we wanted that explicitly stated. The other thing it does is allow spouses to be reimbursed to provide services. It also specifies and strengthens the language that IHSS is a consumer-directed option. So the client or the authorized representative has more control and flexibility in the scheduling, managing of the care, and the supervision of the care that's provided. It allows the client, in conjunction with the IHSS agency, to determine the amount of nurse oversight that's needed. IHSS is very similar to our Consumer-Directed Attendant Support Services, or CDOS program, in that the legislation waives sections of the Nurse Practice Act and sections of the nurse aid legislation. There is still an IHSS agency involved, and so there is some nurse oversight component, but this gives that flexibility to determine the appropriate amount of nurse oversight for each individual. The 5th part of the legislation removes a 444-hour per year limit on personal care and authorizes the department to set a new limit. And in the rule, we have changed that to 40 hours per week for personal care, so it's more in line with CDOS. And then the sixth component was specifically stating that IHSS could be provided in the spinal cord injury waiver. IHSS is already provided in that waiver, and we just did not have it specified in statute nor in our rule. While we had the rules open, there were two other changes we wanted to make. We wanted to clarify some of the service definitions. We currently reference the overarching personal care and homemaker rules. We'll continue to do that. There was a health maintenance rule that was in the IHSS rules, but it was not clear. So we've worked with Health Department, Colorado Department of Public Health and Environment, and stakeholders to draft new language to add more clarification. And then secondarily, adding a component in there that authorized representatives are not necessary if there's an agency that's able and willing to help the client direct the care. This was a recommendation from stakeholders to include as we start looking at expanding IHSS into waivers such as waivers that support folks with developmental disabilities, mental illness, or brain injury. The very unfortunate reality is sometimes those people do not have families who can assist them with their care. IHSS agencies have additional roles and responsibilities to support people in making those decisions. So we wanted to allow some more flexibility so more people could participate in IHSS. We opened it up for public comment. It is still open. Public comment will end at the end of this month. Thus far, we've received two major questions. One was seeking additional clarification about the definition that we've worked on for health maintenance. So we continue to work with stakeholders and with Health Department to clarify that language. And then the second piece of stakeholder comment that you saw in your packet was around authorized representatives and just making sure that agencies cannot be actually designated as an authorized representative, rather just assisting the person in making those decisions.
Okay. Great. Questions from the board on this rule? No? We do have somebody signed up for public testimony. We have 3 people signed up for public testimony. The first individual is a Mr. Kevin Smith. If you could come forward and introduce yourself, who you represent, and your support of the rule, please. I'm not sure if that cord will...
Hello, board members. Thank you for allowing me to actually testify on this rule's behalf. Basically, just going to go over some of the things that Candy was...
Could you introduce yourself for the record, please?
Sorry, my name is Kevin Smith.
Thank you.
I am a IHSS recipient under the EDD HCBS program.
Thank you.
The first thing I wanted to go over was just basically how my history under the Medicaid programs. I've been on the state programs for over 30 years now, since my injury. I was under the state plan, skilled nursing, CNA services for the majority of that. Then IHSS came about 10 years ago. I decided to go ahead and change over to that due to the ability to pick and choose the type of services that I wanted. Now that the rule changes in allowing people to actually, that are on IHSS, receive services in the community is a definite bonus for me. I'm very active. I have a job. I like to, camp, fish, hunt, all these things. And now this is going to allow me to actually have those services, and the person that goes with me be able to be reimbursed for those. one of the other things I want to go over is just the amount of nurse oversight that is required under the state plan is, you know, in my situation, I did not require that. I am competent enough to be able to control my own care. Whether I wanted a nurse to change my catheter on a certain day or whatever, I mean, that now it's up to me when I have that done, whether it be through a health maintenance person or through a nurse. It's my choice. So having that ability to have care in the community and the type of services is the main reason why I'm so in support of this program. Let's see. And the other one is I just recently changed over to the spinal cord injury waiver. Now adding IHSS into that is another plus for me. So those are the things I would add for this.
Wonderful. So I'm assuming you're in support of the rule, how it's being written.
Totally.
All right, thank you. Questions from the board for Mr. Smith at all? Thank you very much for coming and your testimony. Appreciate that. Also, we have Pat Cook. See, I read it this time well.
That's because I do, right?
If you could come and introduce yourself again and your position on this rule.
Sit over in the higher chair. I'm too old for that. I'm Pat Cook, again with the Colorado Gerontological Society. I am a retired nurse, been actively engaged in senior issues for the last 3 years, and IHSS is one of my things that I think will really benefit the senior community. We have a lot of education to do with them. We have a lot of education in the provider agents as well, because we are already getting calls from seniors not understanding the process or understanding how the agency works with them. So we're trying to be advocate, but we support this bill. I know that Dave's going to talk about a couple of things, but I'm going to also support that we need to broaden the definition of oversight to licensed professionals such as PAs, nurse practitioners, RNs, medical, the doctors, the DOs, because I don't think it particularly requires an RN for all people. I think some people will benefit from case management. I know those with the dual project under Colorado Access and other RICOs will have case managers that way. And we don't need to burden people with a lot of case management. We need to keep it streamlined, easy, and we need to have a flow that works from A to Z. What we see out in the market is that we see a lot of people giving direction to folks, and then that causes confusion and irritation. So I hope that as we work this through, that we work on that piece of the process. I think the other wonderful thing about IHSS is going to allow my younger disabled community seniors that are between 60 and 65 more freedom. We want to get many of them back to the job market. They're suffering from being impoverished, and it's not working. And housing is a disaster, as you all well know. And you cannot afford housing at $800 a month income in the Denver market or the Colorado Springs market. So those are things that are important. Outliers around this process and how we can give people working, keep them happy, make sure they have the services they need. I also want to alert the board that we're in the middle of a very interesting situation where a company did not provide enough oversight. Their caregiver did become a representative PE and wiped out a senior's whole assets and got a lease signed by the senior. So we've been very engaged on the elder abuse law and all of the teaching and working with the DA offices. I sit on a forensic team in 2 counties. So we just need to really strengthen that the IHSS agencies understand their responsibility, complaints, and risk management on this, and that they train their staff and that they watch for signs of this situation, because we don't want to see this become a vehicle of ripping people off.
Great. Thank you very much. Any questions for Ms. Cook? Appreciate all your efforts in this, and thank you. The last individual we have signed up for this testimony on document 4 is David Boland. welcome. If you want to come forward, introduce yourself, who you represent, and your position on this rule.
Mr. President, members of the board, my name is David Bowen. I am the CEO of Accent on Independence, which was, I believe, the first IHSS agency in the state. And I'm also representing a small trade organization of Colorado Long-Term Assistance Service Providers. I can't get the class, which is an association primarily of agencies that believe in consumer direction and do, all of us are IHSS providers. So I'm here to support the rule with some tweaks to be made before the final reading, primarily around a clearer definition on line 18 of the rule on page 1, so we have a clearer definition of what this in absence of worsening condition or new symptoms is, because it doesn't really tell us as a provider anything. And then I don't think it would tell any of our consumers anything either. But we also want to make sure that when we're doing that we preserve consumers' rights to direct their own care. There are times that that sometimes the Department of Public Health and Environment wants to ensure safety beyond the scope of people having the right to make their own choices. And so we want to make sure of that. And then I'd like to, and part of it's my own oversight. I was involved in writing both bills for IHSS, and we put in nurse oversight into the bills, and that was a mistake. It should have been licensed healthcare professional. And so throughout the rule, wherever it says nurse oversight, we'd like to be able to put in licensed healthcare professional, which is the definition of what an agency is required to have, at least at a nurse level, but it could be many other people. And so we want to make sure that we're not requiring every agency to hire a nurse or have a nurse under contract when, if, for example, they have a doctor who is doing that. Unlikely as that would be. But, you know, in that event, we want to make sure that we're saying it's the licensed healthcare professional. I will tell you, it's been a pleasure working with the department on this. We've had spirited discussions at meetings, and well, I like.
They're still smiling, so that's good.
They're used to us. They're used to advocates, and so that's what makes it even more fun. But it's been a pleasure to work with the participant directed people, which is primarily Candy and then now Grace, because we've been able to really move this along in a way that makes a lot of sense. And we had really good investigation around what do we want to call these service definitions. How do we want to define them in a way that makes sense? And so that's where most of the discussion was, and we had fun. So that concludes my testimony. Thank you.
Ms. Dalton, what comments do you have for Mr. Boland's suggestions there?
Thank you, Mr. President, members of the board. Line 18 is what I was talking about, where we're still working with Health Department based on stakeholder feedback. So we are working with stakeholders and the Health Department to get clarification on that language.
Okay.
And we'll have that clarification before we come back for the second reading. For line 32, or excuse me, line 31, where it talks about nurse oversight, David is correct. In the legislation, it is about healthcare professionals, so we will correct that and bring it back.
Very good. Thank you. Thank you. Other questions from the board or comments? Anybody on the phone with a question or comment? And anyone else would like a chance to sign up for public testimony? Seeing none, we do have a motion and a second for approval of document 4. All those in favor signify by saying aye. Aye. Ms. Lacombe?
Aye.
Ms. Riley?
Aye.
Dr. Givens?
Aye.
Dr. Young?
Aye.
All right, we have initial approval of document 4. Thank you very much, appreciate that. On our motion list, we don't have a motion for consent, but I believe we could probably look at putting documents 2 and 3 on the consent agenda for next.
So I would move that document 2 and document 3 be added to the consent agenda for the December board meeting.
All those in favor, signify by saying aye. And I got a second, thank you. Aye. Ms. Lacombe?
Aye.
Ms. Riley?
Aye.
Dr. Givens?
Aye.
Dr. Young?
Aye.
Great, we've got the consent agenda for next month, and now if I could have closing motion, please.
Move that all rules adopted at this meeting of the Medical Services Board of the Colorado Department of Healthcare Policy and Financing meet the criteria of the State Administrative Procedures Act, which are incorporated by reference.
All those in favor, signify by saying aye.
Aye.
Ms. LaCombe?
Aye.
Ms. Riley?
Aye.
Dr. Givens?
Aye.
Dr. Young?
Aye.
Very good. We are closed with the rules portion. Those of you on the phone, I'd just like to point out that since you called in, you don't get the Enstrom's toffee for Christmas time this year. So there's more to go around here. So just remember that next December. Next on the agenda then is the open forum. We currently, nobody has signed up for open forum. Is anybody back there in the very sparse audience wanting to sign up for open testimony? Seeing none, we will move forward from the public open comments and jump right into some department updates. The first thing that we should have all received in our packet was a Child Health Plan Plus report. So if you haven't had a chance to review through that, please make sure you do. And if you have questions, definitely get back with the department on that. And then the only other piece that we have is a department update from Tom Massey. So
thank you.
You got the floor.
Great, I appreciate it. I'll try to stretch this out for an hour or so so you can get your money's worth out of this meeting. Well, I would like to announce first and foremost, we regret to say that we're losing one of our members here. Mr. Fox has informed us that January will be his last meeting, so we want to honor his service and say we'll definitely miss you on the Medical Services Board here, and hopefully we can find as adequate a replacement as we can, but no doubt that'll be very difficult to do. So thank you for your service.
Thank you very much.
Appreciate it. Right now we're in the middle of JBC presentations. We're over there justifying our budget with the JBC, and we were actually there Tuesday for our main budget hearing, and it went very well. As a matter of fact, the feedback we got was it was a model presentation by the department. So hopefully that means that over the last several years we fine-tuned our act to the point where we know what they want, know how to present it. So that went very well. As we speak, Director Birch and some of our other staff are at the JBC right now presenting for the Intellectual and Developmental Disabilities Division. So we wish them well and hope that goes equally as well as the rest of our presentations have gone. So a lot of work goes into this time of year from staff. Everybody is tasked with answering the numerous written questions we have to submit well in advance. So we've had to work a couple weekends and late into the evenings on some of this. So our staff's really done a great job, and that was mirrored by the fact that it did go so well. So hopefully that will continue. We have one more hearing on Monday for behavioral health, and then we'll be done with our JBC hearing. So we'll be glad to get through that. Last week, a number of us had the opportunity to go over to Colorado Springs and attend Colorado County Incorporated, their quarterly meeting, and actually for the first time, the Colorado Human Service Directors Association actually asked us to come in and sit on a panel and speak about things that the department was doing. Our friend Ms. Riley was there to make sure we got peppered with the appropriate questions, which we did, but a lot of it has to do with how we're going to continue to work with counties around eligibility and enrollment issues. We're actually trying to divert more of this to our county partners and get away from some of our vendor relations that we've had in the past, keep it a little closer to home and actually farm this out to counties, which they're very receptive of. So we're working very hard to make that a reality. A number of the counties have asked for us to start providing basically a Medicaid 101 program for some of the turnover they've had in staff, and just to keep them up to speed on how our systems work and what kind of the state of the art is with the Affordable Care Act and the like. So we share a very robust training department that's jointly operated between us and Department of Human Services. So we're going to put that into play, whether it's through web-based or actually putting boots on the ground on a regional perspective, where we get some of our trainers out in the field, because it's very difficult for counties that, particularly our small rural counties that have 2 and 3 people in their departments of human service, to actually get out and spend a couple days in Denver. So we're going to try to go to them more than we're going to ask them to come to us. So I think they're very appreciative of that. They also want us to be very inclusive of them as we work towards strategic planning initiatives moving into the future. So we've committed to that. Most of you are aware that we're in the middle of another open enrollment period for our state-based exchange. To date, I guess through, as of November 30th, they had re-enrolled or enrolled about 10,000 folks. So we'll get new numbers here mid next week and publish those. There are some glitches that we're trying to work through, as is the case with all these very highly integrated, very technical systems, but it's, for the most part, our enrollments, particularly our peak online enrollments, are going very well. Our real-time determinations are up above 85%, which is great for us, the fact that our folks can get on and, in excess of 85% of the time, get real-time determinations in about 20 minutes. So it's been a very positive system for us. It's working very well. So one of the things that we are working on, and we're going to do it again this year, is and Dr. Molinkovich will appreciate this, we're actually continuing with provider reimbursements, enhanced provider reimbursements. So we're going to continue to fund that, as well as there will be we've got another budget ask this year to actually increase those provider rate increases. One of the things the legislature did for us this last year is, originally it was a self-attestation on whether or not you were a primary care provider under Medicaid. They've actually removed that provision, so anybody that bills under Medicaid will actually be eligible for these enhanced reimbursements. So that's going to be a positive thing, as we're working very hard to build our network and increase the number of our providers. Which incidentally, that's a lot of the rhetoric around the Affordable Care Act and expansion has been, we don't have an adequate provider network. I will tell you that our provider network over the last year has increased about 9%. So we continue to recruit new providers, and as we start augmenting some of the reimbursement, I remember years in the legislature when it was always decreasing, as I'm sure our doctor friends here will attest to, that we've gotten away from the cuts now, or start looking at building that back, and that really helps us in our efforts. So probably our biggest need right now is still specialty and dentistry, as our dental benefit is really starting to take hold. And particularly in rural areas, we definitely need to find a way to get more rural dental providers. So that's going to be the thrust of our efforts in that regard. And we actually have set up a new section within the department to actually deal with provider recruitment. And my shop's actually, our county folks are actually participating in that. So whenever we're making county presentations, we're visiting with practices and the like to extol the benefits of being a Medicaid provider. And we've been rather well received. So we're starting to see the fact that a lot of our friends that deliver services realize the social benefit of actually being a Medicaid provider, and that's been very refreshing. That there's that obligation from those folks, and it's starting to really take hold. Let's see, what else do we have? You passed a rule last month about CDAS financial management systems transition, which you might remember. I'm pleased to update you that as of January 1st, there'll be 3 financial management service vendors and 2 employer models. So we're actually starting to put that in place. It's going well. One of the things we're also doing, and you will be a part of that, is between HCPF, CDHS, and Public Health, we've partnered with this Colorado Cross-Agency Collaborative, and we're going to actually meet as boards for the first time, which you'll be a part of. We've never been able to pull that off before, and we're thrilled that it's actually going to happen this year, and it's going to be a big plus to have a real collaborative effort and a lot of cross-communication between these departments that all deal with public health. So, we're thrilled that that's actually going to come to be.
As a reminder on that, check your calendars and put it on your calendars. It's January 21st, 12 to 4:30 for that collaborative meeting, and it's going to be at the Colorado Department of Public Health and Environment. So that's where we're doing that. So
You say 12 to 4:30?
12 to 4:30.
One of the things that
Lunch will
this
be
group
served.
has been tasked with is producing quarterly reports, and the first one will be around behavioral health. So you'll have homework from day one, so that's a good way to start. So anyway, thank you for your efforts on that. We are thrilled to see this actually becoming a reality. Substance use disorder benefit coverage, we've opened public comment period, so please get on our website, review what our standards are, and if you want to make comments or encourage any of your friends or associates, clients, anyone to get on there and actually make comments so we can have a very robust public comment. The last thing I'd like to talk to you about is obviously you all are aware that our close friend and former associate Suzanne Brennan is no longer with us as Medicaid Director. I'm pleased to tell you that coming January 5th, we will have a new Medicaid Director, and that is Gretchen Hammer. Many of you might have worked with Gretchen in the past. She's been the Executive Director of Colorado Coalition on the Medically Underserved. She served as a past board member and chair of the Connect for Health Colorado board. She's been a private consultant, knows our issues very well. We think she's going to be a very capable replacement for Suzanne. We really appreciate all Suzanne did for us to help us move healthcare reform over the last several years. So we were sorry to see Suzanne go, but we think we've got a very capable replacement in Gretchen. So again, she will start January 5th. So we're looking forward to that. Can I take any questions? Anything you want us to take back to the department, or anything you want to cuss and discuss while we're here?
Dr. Malkovich?
Tom, thanks for the update. I really appreciate all the work that the department is doing to ensure an adequate provider network. I think it would be helpful, however, to do a more in-depth presentation to the board about how the department is measuring availability of providers and access for Medicaid patients.
Okay.
I'm particularly concerned about some of the work I've been doing recently around Medicaid specialty access.
Mm-hmm.
And even though we have a large number of providers who say they take Medicaid patients, the number of Medicaid patients they take is quite limited. And we're seeing, at least what I'm hearing in the community, is not as great a problem with primary care access, but a fair amount of problem with specialty access.
No, I think it's a fair statement, and yeah, we'll get that. That's very appropriate, because we want to continue to look at ways that we can improve that, and how we can actually get out and promote more. Because specialty care is definitely one of the holes we've got in our system. But you're familiar with Project Echo out of New Mexico? I mean, we're really looking at, and we've actually drawn some grant funds to make that a reality here as well. So that will help. And for those of you that aren't familiar with it, Project Echo is a program instituted in New Mexico. Oklahoma has a similar program where specialty docs can consult via telehealth with primary care docs, and it at least gives our primary care docs access and our clients access to specialty care, whereby they can be reimbursed as part of the system. It's something we think is going to be very beneficial, particularly for some of our landlocked and very rural areas.
And as you bring that back, if you kind of let us know how it is regionally across the state,
Absolutely.
that'd be great.
Yeah, we'll definitely keep you updated on that. I will say things are going very, very well for us. It's interesting because we have to tout our successes very gently, because on one hand, we've done an extremely good job of enrolling people in our Medicaid program, but we can't shout that too loudly these days, so we have to kind of keep that below the current. It's going to be an interesting year in our state house, particularly given the new makeup. So we're thinking we're probably going to have to play defense on a number of things that are going to happen down the street. But, you know, the good news is even for, irregardless of where you sit on the political spectrum, one of the things the governor originally tasked us with was being very cost conscious and very appropriate service, appropriate venue, you know, appropriate time. We've been very conscious of that, so I think even for the critics of the Affordable Care Act, we'll be able to say that everything we've done in Colorado has been with an eye on the appropriate services at the appropriate cost. So we'll continue to operate in that vein, and hopefully everything will continue well with the exchange through their next enrollment period, and we'll sail through the legislative session and see where we get next year. But again, thank all of you for your service. You know, we're always here for you as an asset or any information you ever need. So that is our department update.
Great, thank you. Any questions for those folks on the phone for Tom?
There you go.
I guess not.
Jenny, was I hard enough on you at the meeting?
Yeah, we needed some of, you know, we were going to have to plant those questions anyway, so you were perfect.
I'm sure you represented us all well, Jenny. Last thing then is something that Judy had brought up last month at this about the audio recordings of the Medical Services Board being posted on the website. And just wanted to bring that back to the board. Is there any concerns at all with doing that? They need to be made available anyway, and posting them right to the website seems to be the appropriate place to do that. It'll have the current year's board meetings along with the previous years. That'll be posted there, and then after that, I'm assuming they're being archived somewhere. So I would suggest that we kind of move forward with that, with utilizing the website. Did you need any more specific information, Judy?
No, just mostly any concerns or questions or ideas.
Okay, great. So keep bringing those to Judy. Remember the January 21st, then, the collaborative meeting. And Mr. Fox, I'm hoping you'll be back one more month, so we'll see you then, and we can maybe roast you at that point in time. How's that?
Well, second thought, I might not be
We're better on the phone even, you know. So, but thank you very much for everything that you've done for us. And with that, we are adjourned. Everyone have a wonderful December.
Thanks for the topic.
You bet.